Briefly, post-traumatic stress disorder, or PTSD, is a psychiatric condition that occurs when somebody is exposed to a significant life trauma. Either they were traumatized themselves, or they witnessed or became aware of trauma happening to somebody else. And usually, what happens in this case is the person develops coping strategies that are sort of to deal with the traumatic experience, but are ineffective in day-to-day life. So, for example, they start to re-experience the trauma, so experience flashbacks or nightmares around the trauma. They might experience sort of psychiatric conditions around it, or psychiatric symptoms such as depression, anxiety. They might experience insomnia, difficulty sleeping. They might get very sort of irritable and jumpy and anticipate that a trauma is around every corner. So usually this occurs after sort of several months after experiencing the trauma, and usually lasts for a long period of time, including generally years, and is only really resolved with intensive treatment. So in terms of how post-traumatic stress disorder affects a person's family, their loved ones, their relationships, can actually put a big strain on those relationships. So, for example, when somebody is experiencing symptoms of post-traumatic stress, they feel like separated from their loved ones. They feel like they can't be as connected to them. They're experiencing greater irritability, greater depression, and other symptoms that creates sort of a divide between the individual and their loved one. And oftentimes, people with post-traumatic stress disorder will continue to work, but their enjoyment of their job and their performance on their job can be affected by psychiatric symptoms related to PTSD. For people who continue to work who have post-traumatic stress disorder, often it can create greater anxiety and stress on the job. Some people with post-traumatic stress disorder find it very difficult to maintain their employment, and obviously that has a big impact on someone's personal identity in terms of their ability to identify themselves with their career, and also economically, because they may not have the financial support that they were used to living with. It can also affect people in terms of leisure pursuits. For example, people with PTSD often sort of pull back from their friendships, often see their friends less frequently, maybe even alienate their friendships if they're more irritable and standoffish. And this results in them having greatly reduced sort of quality of life, and quality and sort of richness of their relationships and their leisure activities and the things that they used to enjoy doing. We know that people who grow up in families where others have experienced significant trauma and maybe also post-traumatic stress disorder are significantly more likely themselves to develop to experience trauma and to develop post-traumatic stress disorders. And we see this oftentimes in situations where people are exposed to significant stress over multiple generations. One thing we do know about the military is people who are in active military do tend to have somewhat higher rates of gambling disorder than do people who are not in the military. We also know that veterans who have served in combat roles can be significantly more prone to develop post-traumatic stress disorder in certain situations. There is some significant research that's come out of the VA system, particularly the Brecksville hospitals in Cleveland. They've been doing work for decades. And what they've looked at usually is the rates of gambling disorder and post traumatic stress disorder or trauma among veterans who are receiving residential care. And they've found some really, I think, interesting results around the rates of trauma, childhood trauma, post traumatic stress disorder, and so forth. And so we do know among those veterans who go for treatment for gambling disorder, they are significantly more likely to have post traumatic stress disorder. But when we're looking at the general population, most of the people we see in general population or treatment populations outside of that veteran population have experienced traumas related to other sorts of things like sexual assault or accidents or disasters and so forth, and not so much combat action or combat stress. So there's not a lot of research out there on the relationship between gambling disorder and trauma or post-traumatic stress disorder. But what is out there is a pretty good quality. There are a handful of studies that have looked at childhood trauma and the relationship of childhood trauma in the development of later addictions, including gambling problems later in life. And those research studies have largely found that people who experienced childhood trauma in the form of physical abuse, sexual abuse, emotional abuse, and neglect have a greater chance later on in life of developing gambling disorder. Coping strategies and therapy are really important when it comes to understanding how to address post-traumatic stress disorder and gambling disorder. The general consensus is that when you're dealing with somebody, a client who has both of these issues, you should be addressing both the gambling problem and the trauma at the same time. A problem, though, that we have in the gambling disorder field is that if you were to survey, uh, 100 people who have a gambling disorder, only about 10 of those people would likely say that they've ever received any sort of help for their gambling problem. But when we've looked at populations that have included both people with gambling problems and post-traumatic stress disorder, what we found is a majority of those folks have actually gone and sought mental health treatment at some point in their life for the post-traumatic stress disorder. And what this often means is because sometimes the gambling ends up being, in part, a way of coping with the trauma and the anxiety related to the PTSD. The gambling in and of itself isn't seen as a primary problem and is not necessarily given as much weight in treatment as is the post-traumatic stress disorder. And unfortunately, what that means is you don't have a sort of a coordinated treatment approach addressing both PTSD and the gambling. So we know that there are some types of interventions, including things like seeking safety, EMDR, and so forth, that could be used to address both co-occurring problems, the PTSD and the gambling disorder. However, we're at the very beginning of research in those areas, and there are actually only a couple of very small pilot studies that actually look at those types of treatments when we're addressing those combined problems. We're far behind the substance abuse field, for example, where there are a substantial number of clinical trials looking at combined treatment of, say, cocaine use disorder and post-traumatic stress disorder. So my hope is that we can do more work in this area and get a better understanding of how we can address both problems together. I think there's a good rationale to be made for incorporating recovery coaches or peer support into the treatment of co-occurring gambling disorder and post-traumatic stress disorder. We are talking about sort of a tricky clinical situation. We're trying to understand how the trauma and, say, the gambling disorder interact. And oftentimes it's not just two things going on. So there may be a mood disorder occurring or anxiety disorder. There may be alcoholism or drug use problems that are complicating the picture as well. So in addition to having peer support, peer counselors, recovery coaches, or other folks assisting a person through recovery, I think it's also important to have structured clinical treatment, whether that's outpatient treatment, or in some cases, some folks might benefit from residential or intensive outpatient approaches as well. We've done research on post-traumatic stress disorder and trauma over the past couple of decades. But over that time, there's been a growing number of research projects that has looked at gambling in addition to either experience of trauma or experience of post-traumatic stress disorder. And I think to be able to put that into perspective of sort of where we've come from to where we are now, I think will be really, really interesting. In addition to that, I'm going to present on just how little research there is in terms of treatment research out there. There's really only a couple of small pilot studies, but I will be able to at least talk a little bit about a study that we've been doing over the past few years, where we've been using Lisa Najevitz's seeking safety model to address co-occurring gambling and trauma among problem gamblers in Canada. Seeking safety is a cognitive behavioral treatment approach for looking at both gambling problems and trauma. So the idea behind this is that it gives people sort of a sense of what are the factors that affect their gambling related to their trauma, and also gives a sort of a safe place for both the client and the clinician to sort of explore how that affects their addictive behaviors. Resiliency is a really important factor in terms of being able to handle trauma. Not everybody who experiences a significant trauma in their life will go on to develop post traumatic stress disorder. And it's not all about resiliency. There's a lot of different factors that play into that, including sort of one's initial mental health and how resilient they are, but also what kinds of experiences they had in childhood. A person, for example, who experienced traumatic experiences when they were a child and then go on to experience a traumatic experience as an adult may be substantially more likely to develop PTSD than someone who had a childhood that involved no traumas, for example. When we're talking about resiliency, we're talking about one's sub characteristics that maybe protect them from developing symptoms after experiencing a trauma, and it's difficult to sort of characterize that, but because everybody is sort of different in that respect. But sometimes people who have sort of protective factors like good solid relationships, generally they deal well with stress, those folks may be less likely to develop PTSD than folks who have more difficulty in those areas. Right now we're at a time that's particularly stressful because we're experiencing a worldwide pandemic. In the United States and North America broadly, we're experiencing a lot of sort of contention around an election that's coming up. And oftentimes that can create a lot of additional stress, particularly among people who already are experiencing stress and coping difficulties related to traumas. And that can affect people individually. And I think it can also affect people intergenerationally in terms of experience in certain conditions in the African American community and the Native American community, when there is a great deal of intergenerational trauma that's sort of gone through many generations. And it can sort of culturally sort of result in people experiencing a greater deal of stress in times like this.